Next common thing that we see is trigger finger. Now trigger finger presents as locking and catching of the finger, especially more common first thing in the morning, and as the day passes it becomes easier and easier. And when the patient makes a fist, so make a fist for me, and then extends it. In a normal case you would be able to get all the fingers out, but in trigger finger, like you see in this video, the patient flexes the fingers down and the finger gets stuck, and then he has to use his other hand to unflex the finger. Examination of trigger finger is usually quite easy, as they can easily demonstrate what the problem is in front of you by showing you the clicking of the finger or the clicking of the thumb as well. In milder form of disease, when the patients cannot show you the locking and clicking in clinic, we can examine their finger by palpating around the A1 pulley. This is just over the metacarpophalangeal joint of the finger. Around the A1 pulley, the tendon usually catches and locks because it has become very bulky and thickened. So we palpate around the A1 pulley for any discomfort and pain, and when we move the finger, we can actually appreciate this locking and catching and a grating sensation, and that would usually be a giveaway. Also, when we are palpating and moving the finger, the patient will say, yes, that is my problem and that is uncomfortable. So that will be a nice way to examine a mild trigger finger which the patient cannot demonstrate in front of you. Similar problem can occur in the thumb in the form of trigger thumb, and there also we palpate around the MCP joint, and usually we can find a very thick lump, which is usually the pulley, which has become very lumpy and thick, and the thumb clicks and locks on movements, and any palpation in this region, and while palpating if we move the thumb, is painful. That is how we will tell a trigger finger apart. I have seen doctors getting confused between a trigger finger and a Dupuytren's contracture. In Dupuytren's contracture, we cannot passively extend the finger, and you can normally see cords running along the palm in the finger. Whereas in trigger finger, the skin will be entirely normal. There won't be any cords to palpate, and there is only catching and locking with full extension possible. Thank you.